Bethesda Inc. has been instrumental in helping Hospice of Cincinnati develop some very innovative programs for the community. PalliaCare and Conversations of a Lifetime have both had a tremendous impact on being expanded offerings and support that are available for patients and families when they're trying to live with advanced illness. And those programs weren't available before.
To say to her mom, while she can still communicate it, what do you want me to do? And her mom was then able to really thoughtfully think about and make some new decisions about what she wanted at end-of-life care. And her daughter looked directly at her and said, "Thank you for having this conversation with me."
PI3 has played an instrumental role in bridging the funding gap in a fee-for-service world until we've got a more mature, value-based, population health-based payment model. So it's really helped introduce and provide those startup dollars to cover the infrastructure, to get the programs built, and to be able to prove impact and outcomes so that we have a story to share with insurance companies.
I think specifically of an elderly woman in her 80s who had been to the emergency room 20 times in the last 12 months. And that had been across multiple healthcare systems. And so when we got into the home and what we were able to see, she's living alone. She does not have a caregiver on site with her. Her box of medicine that was delivered 2 weeks ago is unopened. How can we work together to make sure that we avoid the emergency room is really kind of an eye-opening kind of thing.
What we've seen are some pretty impactful measures in terms of quality of life and in terms of utilization of healthcare. The nurse practitioners ask and measure what a patient and family's experience and impact is with their understanding of their illness, anxiety, pain management, shortness of breath. And what we've seen is that there is a marked difference in symptoms within 30 days of involving the program. On average, about a 33% improvement. So, which is amazing impact on quality of life. This program offers not only someone that is coming to their home to see them, but the availability of around-the-clock support by having a registered nurse on the other end of the phone to help really prevent those medical crises so that they're spending less time in the emergency department and in the hospital and more time at home with their families doing what they really want to be doing. Our Hospice of Cincinnati Navigator umbrella, HOC Navigators, really brings together that collective of Conversations of a Lifetime, PalliaCare, palliative medicine, hospice, and our grief programs under one umbrella. What it's allowed us to do is really look upstream and be able to anticipate and be more proactive in serving the needs of not only patients, but also families. Through BI3 providing the support for these programs, it's really helped us move out in the forefront in terms of being innovative, thought leaders, and be able to really go to where the need is and be able to step back and reflect more broadly, seeing where the unmet needs are, and knowing that we have resources to be able to essentially develop the programs and support to meet those unmet needs.